Welcome to this explainer. If you're tuning in today, chances are you or maybe someone you deeply care about has been battling chronic gut issues like irritable bowel syndrome or IBS. And right out of the gate, I just want to acknowledge how utterly exhausting that is. Constantly managing symptoms, mapping out bathrooms everywhere you go, hyper-restricting your diet, and just generally feeling like your own body is literally working against you. It is incredibly draining. But today we're going to look at the actual science of what's happening inside your body, and we'll explore a highly effective, scientifically backed path forward. Okay, let's dive into this with a massive core truth. It's not that your gut is broken, it's that the signals are being misread. I really want you to let that sink in for a second. For so many people with chronic gut issues, the physical pain, the bloating, the sudden urgency, it's all incredibly real. No one is making it up. But the root cause? It might not be a broken digestive tract. Very often, it's a profound miscommunication happening between your brain and your gut. They've basically stopped speaking the same language. To understand how that happens, we have to look at the biological hardware that connects the two, the vagus nerve. Think of this like a massive biological information superhighway. Your brain and your gut aren't isolated systems at all. They're in constant 24/7 conversation, sending text messages back and forth all day long. It's exactly why you get those nervous butterflies in your stomach right before a huge presentation, or why a sudden stressful phone call can send you running straight to the restroom. Your mind and your gut are totally inextricably linked. Now, here's where things go a little sideways. In conditions like IBS, this whole communication line becomes totally hypersensitive. The specific areas in your brain that regulate your attention and process the emotional side of pain, they become way over alert. Honestly, they start acting like a hyper-vigilant, overly caffeinated security guard. Your gut might just be digesting a perfectly normal meal, just doing everyday gut things. But your brain is listening way too closely. It misinterprets normal digestion as a massive threat, and it responds by immediately cranking up the volume on pain, bloating, and discomfort. And this kicks off a rapid, totally vicious cycle. Watch how fast this escalates. Step 1, you hit a mental stressor, like a crazy tight deadline at work. Step 2, your body responds immediately, manifesting that mental stress as physical gut symptoms. Step 3, those sudden physical symptoms create a whole new layer of intense anxiety. Now you're stressing about the pain, you're stressing about needing a bathroom right now, which shoots right back to step 1. More mental stress, creating more physical symptoms. It spirals so incredibly fast, and you just get trapped in this loop. And this brilliantly illustrates something absolutely crucial. It literally doesn't matter which way the cycle starts. Everyday life pressures can absolutely trigger physical discomfort. But conversely, a sudden physical flare-up when you're completely 100% calm can instantly trigger anxious protective thoughts. Like, why is this happening now? What if I get stuck here? Regardless of how you enter the loop, the result is exactly the same. Your body gets locked into that identical, stressed, highly reactive state. Biologically speaking, that state has a name, the sympathetic nervous system. Yep, the famous fight or flight response. When your brain perceives a threat, whether that's a literal lion chasing you, a wildly stressful email from your boss, or just a sudden cramp in your stomach, it activates this system. And here's the undeniable biological truth of it. When the sympathetic nervous system is running the show, digestion completely shuts down. It is biologically impossible for your gut to function smoothly while your body is convinced it needs to fight for its life. Which brings us to a really major paradigm shift. If you've been dealing with this, you've probably spent countless, exhausting hours analyzing every single thing you ate, trying to pin down the exact trigger for every flare-up. Was it the garlic? Was it the dairy? Actually, scratch that. While diet definitely plays a role, we need to stop chasing the exact cause of every single symptom. It's completely exhausting and keeps you hyper-focused on the problem. Instead, we have to start working directly with the underlying communication system, the nervous system, that's actually driving the cycle. We need to intentionally slow things down. We have to teach the body to shift gears, away from that reactive fight or flight sympathetic state and ease right into the parasympathetic nervous system. This is our state of rest, settle, digest, and repair. To truly heal the gut, we basically have to hit a gentle neurological reset button. We train the brain and the body to spend much more time in this calm, regulated state so the gut can finally do its job in peace. So, how on earth do we actually flip that neurological switch? Enter Section 10, Gut-Directed Hypnotherapy, or GDH. First off, let's be super clear. We are not talking about a magic trick or some cheesy stage entertainment here. GDH is a highly specialized, evidence-based clinical hypnotherapy. It combines deep, soothing physical relaxation with very focused mental attention and targeted imagery. The whole goal is to calm and permanently retrain that vagus nerve communication line. And this is key. When you're in hypnosis, your brain doesn't just switch off or go to sleep. It shifts into this highly focused, super receptive state where the specific parts of the brain that amplifies stress and pain finally quiet down, letting new, much healthier communication pathways form. So, who is this actually for? Well, it's validated for a very specific set of conditions. We're talking all subtypes of irritable bowel syndrome, functional dyspepsia, severe bloating, and chronic abdominal pain where doctors literally cannot find a structural medical cause. But most importantly, this is for the exhausted patient. If you've tried those ultra-restrictive low FODMAP diets, choked down handfuls of supplements, bought all the probiotics, and tried the medications without getting any lasting relief, this offers a remarkably powerful, non-pharmaceutical avenue for real hope. Now, what's really interesting about this slide is the sheer scale of how effective this is. Studies consistently show that 70 to 80% of people with IBS experience meaningful, significant symptom improvement after a course of gut-directed hypnotherapy. 70 to 80%. That is huge. But wait, here's the absolute best part. Those results actually stick. Long-term follow-ups, even 5 years after finishing treatment, show that patients maintain these incredible gains long after they're done with their sessions. And if you're kind of sitting there feeling a bit skeptical about the word hypnotherapy, just take a look at the institutions backing it. This is definitely not some fringe wellness trend. GDH is a mainstream, deeply researched psychological intervention. It's officially recommended by the UK's NICE guidelines, the American College of Gastroenterology, and it's actively used in literally some of the most prestigious medical hospitals in the world. We're talking the Mayo Clinic and Monash University. The medical establishment absolutely recognizes its power. But hey, it's equally important to understand what GDH is not, just to clear up any lingering stigmas out there. First, no way is it mind control. No one can make you do anything against your will. Second, and I really cannot stress this enough, it does not mean your pain is all in your head. Your physical symptoms are 100% biologically real. We're just treating them right at the source of the misfired signals. Third, it definitely doesn't replace a doctor, so always get new symptoms checked out. And finally, it's not a magical overnight fix. It's a gentle, very gradual process of retraining your entire nervous system. So what does it actually feel like to do it? Let's walk through a typical session so you know exactly what to expect. You'll be in a session for about 45 to 60 minutes. You stay awake, you're completely aware, and you are in total control the entire time. You basically just sit or lie down comfortably, and hey, closing your eyes is entirely up to you. A therapist will gently guide you into a deeply relaxed state, kind of like that super cozy feeling right before you drift off to sleep. A full course usually runs about 7 to 12 sessions, and you'll often get audio recordings to practice with at home. It's incredibly safe and profoundly relaxing. Let's move to and see how this builds during the actual therapy. Once you're in that deeply receptive state, the therapist uses highly targeted mental imagery to essentially teach your gut how to settle down. You might be guided to picture your digestion as a smoothly, peacefully flowing river. Or maybe you visualize a calm, warm hand resting perfectly comfortably on your belly. Or you might picture your internal systems as a beautifully oiled, well-regulated machine, just humming quietly in the background. These vivid mental analogies directly soothe that hyperactive feedback loop we talked about earlier. So the crucial point is how this systematically heals the body over time. It's really about the compound effect. As you repeat these sessions, step 1, the overall hypersensitivity in your nervous system drastically reduces. Because of that, step 2, your brain finally starts accurately interpreting the signals from your gut instead of constantly sounding a massive false alarm. And ultimately, step 3, with the fire alarms finally turned off, your body is totally free to support natural, regular, and comfortable bowel function. You've taught your system a brand new pattern of safety. Which leaves us with one final, pretty big thought. If you are totally exhausted from fighting your own digestion, if the ultra-restrictive diets and all the pills just haven't broken the cycle, well, you now know that your gut isn't actually broken. It's just a miscommunication. The tools to fix that biological wiring exist, they are scientifically proven, and they are entirely within your reach. So I'll just leave you with this question. Are you ready to finally change the conversation between your brain and your gut? Thank you so much for joining me for this explainer, and here's to finding real, lasting relief.